Hello, my name is Siobhan O'Brien and I am an Alumni Relations Officer here at McGill. Welcome to our webinar on gender and pandemic. Before we get started, I would like to cover a couple of housekeeping points. To ensure the best connection, it can be helpful to close other applications on your device. By default, attendee microphones are set to mute and webcams are off. If you wish to communicate directly with the organizers or the panelists of this webinar, either for a technical concern or to pose a question, please use the questions dialog box, which can be found in the dashboard to the right of your screen or at the bottom if you're on mobile. We will be posing a couple of questions using our poll feature, which you will see now. Please take a minute to answer. Thank you very much for taking a minute to answer our poll. As it looks like that we are predominantly a female audience today, and I'm hoping that you will get a lot out of our presentation. I would like to introduce you to our panelists. Dr. Nasreen Khatri is a registered clinical psychologist, gerontologist, and neuroscientist, an educator with over 15 years of professional experience. Dr. Khatri completed her clinical internship and CIHR-funded postdoctorate at the Center for Addiction and Mental Health. From 2004 to 2012, she led the Mood and Related Disorders Clinic and founded the Cognitive Behavior Therapy Service at Baycrest Health Sciences. Since 2012, at the Rotman Research Institute, she has studied the neural link between midlife depression and the development of dementia. She innovates treatments for depression and anxiety for older adults, including CBT, mindfulness, and exercise. Dr. Khatri's research has been funded continuously since 2006 and has been published in peer-reviewed academic journals and book chapters. Dr. Khatri has completed over 400 presentations, serves as a mental health advisor to Bell Let's Talk, Girls eMentorship, Women's Brain Health Initiative, the Jane Goodall Foundation, and has been cited by CBC, CTV, the Globe and Mail, the Wall Street Journal, and 20 other media outlets. In 2013, she was awarded the Women of Baycrest Innovators and Research Award, and in 2016, the Government of Ontario Leading Women Building Communities Award for the enormous impact of her work as a psychologist and gerontologist at Baycrest. She is also a proud McGill alumna and current vice chair of the McGill Women's Leadership and Philanthropy Group in Toronto. Dr. Claudia Mitchell is a distinguished James McGill professor in the Faculty of Education at McGill University and an honorary professor at the University of KwaZulu-Natal, South Africa. At McGill, she is the director of the Institute of Human Development and Wellbeing and the founder and director of the Participatory Cultures Lab, a research and training unit in the Faculty of Education funded through the Canadian Foundation for Innovation. Her research focuses on participatory visual and art-based approaches to working with young people and communities in relation to addressing critical social issues such as gender equality and gender-based violence, and in a wide range of country contexts in West Africa, Southern and Eastern Africa, East Asia, Pacific, and India. She currently leads several large funded projects focusing on girl-led from the ground up policymaking to address sexual violence and Indigenous girls in Canada and South Africa. She is a fellow of the Royal Society of Canada, a Pierre Elliott Trudeau Foundation Fellow, the 2019 Leo Gérin Laureate in the Social Sciences in Quebec, and the recipient of the Gold Medal in Research for the impact of her research with young people, awarded by Social Sciences and Humanities Research Council of Canada. She's also the co-founder and editor-in-chief of the award-winning journal Girlhood Studies and Interdisciplinary Journal. She's the author and co-editor of 30 books, including Disrupting Shameful Legacies, Girls and Young Women Speaking Back Through the Arts to Address Sexual Violence, and Participatory Visual Methodologies in Global Public Health. Before we get started, I will now launch just a couple of other questions to help inform our discussion today. Please take a moment to answer the poll on the screen. Just give you about another 5 seconds or so. Okay, so we'll just share the answers to those one. It looks like it's pretty evenly distributed between impact on employment and economy, mental health impact on and impact on safety of women. Thank you very much for answering that one. And we just have one final question for you before we get started. And this is just our last one. If you could just indulge us with one final answer. We've had about half our participants answer. We'll go about another 5 or 10 seconds. Wonderful. Thank you so much for taking part in that. So here we have, let's see the results here. About a third of you are concerned with losing gains made in past decades, and then also with the echo pandemic of mental health impacts. Just before we get started, so thank you very much for participating in those. Before we get started, I would just like to remind you that if you do have any questions at any point, you can submit them through the question box on the right-hand side. And just a quick reminder that this presentation is being recorded. So if you do need to duck out or if you can't stay right till the end, that there will be a recording emailed to you. We will have time for questions at the end. It's now my pleasure to turn the presentation over to Dr. Khatri as a clinician and scientist of women's mental health, and to Dr. Mitchell, a scholar of participatory research focused on gender equality and gender-based violence against women, who will begin with a conversation of the pre-pandemic state of gender equality compared with current and future impacts of COVID-19 on gender-based aspects of parity, safety, economic, and mental health. Dr. Khatri, over to you.
Thanks, Siobhan. Welcome to everyone, and thanks to all of you for joining us this afternoon. And a special thank you to Dr. Mitchell. It's a pleasure to speak with you today. So let's jump right in. In pre-pandemic times, researchers have shown that even in the most developed nations, women experience social inequalities, such as unequal pay, completing trillions of dollars of unpaid work, example, housework, caregiving, and are at higher risk for childhood abuse and later domestic abuse, some mental and brain health problems. So for example, women are twice as likely to be diagnosed with depression and later with dementia as men are. Can you comment on the state of relative inequality for women today?
Wow, that's a big question, a complex question, and one that I think we're all very concerned about. So thank you very much for asking that, and also thank everyone for joining us today. I think it's a really exciting moment to look inward, look outward, look beyond to see where we are. And Nasreen, it's been so lovely getting to know you on this in preparation for this webinar, and thank you for that, and thank you, Siobhan, for organizing all of this. I think the whole area of where are we now is one that is very important, I think, to think about, both in relation to where we were, but where we're going. There's a really interesting quote from the UN, just came out a couple of days ago, that says, across every sphere, from health to the economy, security to social protection, the impacts of COVID-19 are exacerbated for women and girls simply by virtue of their sex. With the spread of the COVID-19 pandemic, even the limited gains made in the past decades are at risk of being rolled back. And I think that is kind of something that to really hang on to. So I started to think about well, where were we before February or March, and where are we now? One of the reports that I think is really useful to look at is a report put out by the World Economic Forum, the Global Gender Gap report, which looks at 144 countries in terms of their economies, in terms of education, health outcomes, and wage parity. And it's been, I think, a pretty important one. It's been running since 2006. So the most recent report came out on like December the 19th, so just as we were heading into this, so it's less than 5 months old. And one of the startling findings of that report around gender parity around the world is that it's going to take at least 100 years, at the very least, before we reach parity, and that was in relation to what we were finding in that particular report. Iceland and several other Nordic countries lead the way in terms of having the closest parity, but even Iceland, which was the #1 country, is still 14. There's still a 14% discrepancy between men and women on a whole range of issues, from political representation to wages and so on. And it was kind of interesting that the women in Iceland worked for 14% less on one day, to kind of make the point about what does this actually mean. Canada comes out as #19 on this report, and we've actually dropped a couple of points there, and mostly around wage parity. We are very good on education attainments. We're very good on, well, we used to have parity on health outcomes at that time, but in terms of wages, and also looking at who's going into technology industries, and access to childcare, which are areas that actually really keep women back. So I think it's very important to consider that. There was also a report done the same year called the National Indigenous Economic Report here in Canada, which has an amazing gender analysis of where Indigenous men and women are in relation to parity in Canada, but also where they are in relation to non-Indigenous populations. The Indigenous communities in Canada have probably the closest in terms of parity of men and women, but there's the biggest discrepancy between non-Indigenous men and everybody else, which is perhaps not terribly surprising given the rest of the reports that we've seen, but I think says something about how we still have a long way to go in terms of thinking about how do we address some of the social and political issues out there. Something else that I did start to look at, however, is like in terms of work, and what does this mean in terms of the gendered pandemic? And I think we've probably seen a lot of this just in the last couple of months, like who's doing what, who's working from home, who can work from home, and when people are working from home, who's responsible for childcare, and who has the luxury of working from home. We know that even in pre-COVID times, and in countries that have sort of the best in terms of parity, there is no country that has a particularly close parity on childcare. And in the best countries, it's still 2 to 1. And in some of the other stats that we've found, it's like 3 to 1, 4 to 1, that in terms of who's looking after children and doing something else. We also know that we still have 80% of single parent families in Canada and in North America are headed by women. So if we think about COVID-19, what does that mean if you are working, you're trying to work outside the home or working inside the home? What are the challenges in terms of caring for children, caring for ensuring homeschooling, and so on? We also know, I think, that there's some I think some very powerful work that we've seen, certainly in the larger centers around frontline workers, healthcare workers, workers in long-term care. And I just had a slide number 1, I think. I have a few slides here. So slide number 1, Siobhan, if we could just take a look at that one for a minute. When I first saw this chart, I thought it was a striped t-shirt, but it's looking at the women who representing the overwhelming majority of long-term care workers around the world. And it's just a very dramatic one. Canada is on there. I know there are lots of men also working in as orderlies and other work, but this is just like one of the essential services that we've been hearing about for the last since March, since February. And again, thinking about who does not work from home, since it's impossible to do long-term care work from your home. You're going out to work, but just kind of looking at that particular chart, I think, is very dramatic. What's not in that chart and what you don't see are some of the conditions of just, and I'm just taking this as one example. What we don't see are the low paying wages and what that means. What we know that 70% or more of frontline workers, healthcare workers, are women. We know that many of them are in low paying jobs. We know that they can't work from home. And I think one of the things that we'll talk about later in this webinar is that maybe that's a good thing that they can't work from home when we think about what are some of the conditions of domestic abuse and so on. So I'm not trying to say that this is necessarily a good thing, but only to acknowledge that. We also know that there's digital divides in there that are very important. We also know we're getting some, I think, some very interesting studies that are just emerging on what's the stigmatization of working outside the home and in long-term care or other health services areas. I know we have the sense of the cheering for people coming off shift, which is so important, and every day that I think it must be very motivating. But we also know the fears that people have, the fears that frontline workers have, and again, many women of are they bringing the disease home? How are people viewing them? How are they being able to manage cleaning? All of the kinds of things that need to be done. So I think it's and I think there are some reports that are just coming out more in the US than in Canada so far about potential abuse in the workplace, about who has access to protective gear. And this is something that I think when we consider some of the power relations and the power differentials that coexist with gender, that exist with low paying wages, that we also have to look at, that there are a lot of sensitivities in here that we might not know for a long time about the absolute depth and breadth of what this might mean in terms of workers and what they have access to. And then I guess a final point I wanted to say about this one is that really in relation to many other people who are in informal sectors, or people, women, mostly women, who are undocumented, women who are working in personal care because they don't have any choice, and they also might fear being, having to leave the country, or whatever their legal rights might be. And so I think that I think for those people who are working in migration and refugee studies and immigration, there's a lot of data that we don't have yet about what this pandemic is meaning in relation, what it means in terms of gender and work. So those are some of the things that I think we look at as teachers are going back to school. When they are going back to school, elementary school teachers, way more women than men. There are a lot of new areas that I think we're sort of looking at as we go along. I was in a webinar last week talking about people working in museums, and obviously furloughs and layoffs, but some of the lower paying jobs and positions in museums and galleries, many of them held by young women, by women, and the layoffs there. So I think as almost everything that we could have looked at pre-pandemic, I think we need to really study and think about, well, what is the pandemic meaning, and then the after, which jobs will no longer exist, and how are we going to look at those figures as well. I don't know, what do you think, Nasreen?
Well, I think that's very, very helpful, Claudia. Thank you for that. I want to pick up on a couple of points. Overall, it's, I think you've set the background, which is that there's underlying inequities and inequalities that women have been experiencing, everything from gender-based violence to poor health or compromised mental health, to the kind of work that women do. So as the title of this webinar is, whose work is it anyway, is a little bit of a nod to that the kind of work that women do also put them at risk. And I want to pick up on the point where you said that, maybe it's a good thing that some of this long-term care personnel, being, almost 90% women in a lot of countries, is actually safe for them as opposed to being at home. So I want to sort of hear your views on how you think that these underlying inequalities are being exacerbated by the pandemic at the moment, either this pandemic or pandemics in general, whichever point you want to talk about, in terms of safety and in terms of work. Just kind of let's unpack that a little bit more.
Sure, that's. I think, well, as I say, the line about, well, is it safer to be at home or is it safer to be at work where you are unsafe? Which these are kind of
right.
looking at those. But certainly in relation to intimate partner violence, thinking about gender-based violence, I have a slide, Siobhan. I think it's number 3 in my slide area here, that really looks at what some people have described as the shadow pandemic of violence against, and I think we're talking about, are there 2 pandemics, are there more, but the idea of the shadow pandemic and what that means in relation to work, whether the extent to which we're going to see an exacerbated amount of violence in the workplace, but definitely in the homes. And I think that's the piece that has been very, with my team in the Participatory Cultures Lab, this is the area that we've been really looking at, because I think the idea of we have economic downturn, we have economic stress, and this obviously ties into mental health issues as well. But thinking about the ways in which women cannot get out of the home, we've been looking at the extent to which, how do you signal that? I think last week, our Minister of Women's Affairs, Ms. Monsef, was talking about this notion of women not having access to services, not being able to even speak out. And this, of course, is about work, is about working from home or being in the home or not being able to go outside the home, and the possibility that their partner will be abusive. The Canadian government is setting up helplines for perpetrators as well as for women, but thinking through what are those challenges, and when we think about intimacy and privacy and behind closed doors, what does that actually mean? And so many of our programs, and both in Canada but around the world, and I'm seeing this particularly in the context of my work in Southern Africa, that so much of the work is about being able to speak out and to have a community, to have a peer support group, to have someone that you could speak to. And so the idea of people kind of, it's both the frustration of being inside, but also the frustration of worried about work and worrying about what's going to happen after the pandemic or during, that I think that's where we're really seeing very, very elevated numbers in terms of violence. I found it I've been watching this very closely, because from really late March, I think really when people started to think, okay, what does this mean in terms of a lot of different programs? And I don't think it was the shooting and the rampage in Nova Scotia that was the only thing that set this off, but it was really only after, like, April the 25th or 26th, that we really started to see people taking this much, I don't want to say taking it seriously, but becoming more visible. And that's when we know that the Prime Minister has provided more money on women's shelters, but many people in women's shelters are saying that sometimes they're not actually hearing from women because there's no way to reach them. And then how to promote that. And maybe slide number 4. We could just take a look at that for a minute, Siobhan. This is just a couple of. This was just an image within I think it was on CBC a couple of nights ago on the news of I think it's the first national campaign that I've seen on this. And in slide 5. If we could just take a look at that one for a minute, Siobhan. I started talking to some of my colleagues around the world, and across Canada, but the image of the cell phone that's kind of hard to see on your right or on my right, is a new program, a new app for women to be able to alert the police without it's coming back to them, so that they cannot be traced. The other one is it's a Facebook page from South Africa, just saying any woman who needs to travel to find refuge from domestic violence can do so for free on any UK train as of yesterday. The cost of the ticket will be covered by the relevant rail operator. So just kind of thinking through how can we actually reach women? So I think it is about work, but it's also about working in the home. And I'm not sure if that totally answers your question, but it's kind of getting at these very new tensions that we're seeing, and trying to think through of how this really disrupts, I guess, the notion of how do we actually reach women and how do we break silences. And I think there are new silences because of this.
Right. So, Claudia, I think that you're speaking mostly to the idea of how the pandemic has really magnified safety issues for women and the home being unsafe.
Yeah.
And maybe, a couple of reasons for that is the problem of voice and silence, and so that they cannot speak out. And another one is access to services in time. So that's clear. And I also like the idea that you've provided some sense of where the solution is and how we can use technology to keep women safe. So that's one part of it. I think to move a little bit and talk about the work side of it. I read an article recently in the Atlantic Monthly talking about how it's been reported widely that people like Shakespeare and Newton and others did their best work during plagues and pandemics. And the author of the article said that's because they didn't have small children kind of running around at the time. So you know, it's partly sort of tongue-in-cheek, but I think it's a bigger problem, which is that the way that we're able to have dual careers in families is that childcare is being outsourced, either through school or through some other kind of form of care in the home or outside of the home. However, with something like this, with a pandemic where everybody is in the home, studies have already shown that it's more likely that women are going to quit their jobs or be laid off, or be doing both, be working and holding meetings like we are now, Zoom meetings, and taking care of a lot of things like housework, like children, like aging parents, and coordinating any and all activities that are kind of going around socially in the home. So I just want to hear your views on that. The idea that in the pandemic, maybe one of the reasons that women are maybe concerned about and are losing ground in ways that they've actually progressed is because they're back kind of receding into the home space in a way where there's a lot of caregiver burden.
Yeah, that's
what are your thoughts?
Well, I think you have definitely presented that very clearly. I think that also then speaks to kind of this idea of losing the gains that women have made in terms of being out there and I think that those are, I guess, going back to the, like, even in right now in any home, who's looking, how are families deciding who's going to work in the morning or who's going to work in the afternoon, or whose career is more important. And I think in the past you could sort of say, well, I've got to travel, I've got to be here or there, wherever it is, male or female, but neither person is traveling anywhere. So I think some of those studies about, like, even what is happening in the home right now in relation to who's I talk to various families, say, well, I take the morning shift and he takes the afternoon shift, but then how equal are they in the end? I think some of the areas around stress and worry, I think, is also important. It's like not only whose responsibility is it, but also who worries about it. And I know there's a very interesting, I'll put this up on, I think it's slide 2, Siobhan. If you could just put that on in kind of like this, Siobhan. Oh yeah. So this one was just like the widening gender gap in reporting mental health issues, and this kind of talks to really your question, I think, about who's worrying about children. So it's kind of part of the work and part of what else you're doing. So if you look here, that in terms of parents of children under the age of 18, who's more likely to be, who was worrying about them before the data was being collected here in Canada, and then who was worrying about them afterwards. And you kind of sort of see these shooting up of numbers for women, but not so much for men. So it's like, even kind of thinking about not only the work itself, but the worrying of the work, the anxiety of the work, the anxiety of what this means. I did read the Atlantic article as well, and I was very interested in, oh well, Shakespeare could be very busy, pouring out poetry, while his partner was like miles away with the children themselves. So I think that this is something that we're going to really have to look very carefully about in terms of these gains and losses. We're seeing it, I think it's more dramatic perhaps in development contexts, where money is really also disappearing in terms of programs that have been looking at gender equality. Whereas I think in the Canadian context or the North American context, it's not so much that there's been like external support for this, but it's what's happening in relation to the society itself, and will it become more conservative in relation to what's doable and what's expected of women, and what women can aspire to.
Right, and obviously the future is very unpredictable, but I want to kind of end off on a point that hopefully will open up this conversation to everybody who is a participant of this webinar today. You know, overall, we can see that women have made many gains over the past decades. We're concerned that some of those gains are going to be lost because of the pandemic and the impact it has on women's work, on women's mental health, on their physical health, on their absolute, even bottom line safety and lives. So there's kind of multiple pandemics. There's the health pandemic of all of the lost life and the loss of health, physical health through the COVID-19 experience. There is the economic pandemic of mass unemployment throughout the world. There's also this kind of shadow pandemic of safety of women. And then I think finally there's an echo pandemic of mental health going forward. There was a survey released by Angus Reid just recently. It was mentioned on the CBC that the people, most of Canadians, so over 50% say that their mental health has suffered during this pandemic. And the people who say that they've had the greatest downturn in their mental health is women between the ages of 18 and 54, which speaks to the idea of emotional work and who's doing the mind and management, and as you say, Claudia, the worrying. You know, and the other part of it is that the people whose mental health has been least affected are men over 55. So that there's some kind of discrepancy there. But I really want to go forward in kind of unity in terms of the genders about this discussion of mental health, because we know that men don't seek help for those issues as often. Stigma, there's still taboo, there's lots of different kinds of concerns. So whether it's women's mental health or men's mental health, I worry about the echo pandemic because it's going to last a lot longer. So I think in any situation, humans are very adaptable, and it is, relatively speaking, easier to win the war than it is to win the peace. Right. And so with that, I'd really like to turn it over to you, Claudia, if you have any last, give you the last word before we open it up to Q&A with Siobhan.
Well, I'm going to just jump in for one last word on kind of like a moving forward, and then over to Siobhan, if that's okay, on girls and young women. Is that okay? All right. So I think one of the things I work with young people in Canada and around the world, and I guess one of the things we're learning from many of the pandemics of the 20th century or the 21st century of Ebola and AIDS and Zika virus and so on, that we need to listen to the people most affected. And I think there's a lot of research post-pandemic research that allows us to sort of say, oh, we should have listened to women in West Africa for how to treat patients and their families. Instead of just saying don't touch them, they're going to touch them. They're in charge of their family. So we're trying to think through how can we look at this anew. And I guess for girls and young women, I am very interested in not only the activist agenda that we need for the future. I think we're already imagining that this is not the only pandemic and that we don't even know what's going to happen after this, but also thinking of the creativity and the involvement of girls and young women in this work right now. I know of a series that's just being developed by Global Girls, in which 14 girls around the world are making short documentaries about their lives called Her Time in the Age of Corona and what does that mean. But I know that there are some young women out in Saskatoon, I think, who might have logged in today. But we're working on a project called More Than Words, which has really been looking at the impact of young women making videos, taking pictures, expressing their views, and particularly in the context of gender-based violence, and the impact that work is making. And I'll just maybe ask to see slide 5, number 6, Siobhan. So here is a group out in Saskatoon, Treaty 6, Young Indigenous Women's Utopia. And they made a cell film a couple of years ago, which really brought to light what it means to grow up in an urban context as a young Indigenous woman and what needs to change. And the video itself, if you want to access it, I've just given a couple of email addresses there. But this work about what needs to be done and who should be driving this. And I really see that what we absolutely need is methods, tools, approaches that are going to hang on to activism and are going to hang on to creativity, because I think the next wave of what we need requires a great deal of creativity, and I don't think we want to wait until we're in the post-pandemic to figure out what that would have been. Most of the work that we have on pandemics is looking back. And I think we can learn as we are in the middle of this, what kinds of things we might do. So I just want to kind of put that out as an example. We have work in South Africa with girls and young women whose own activism has helped us see how important it is to think about forced marriage and early marriage, again, through their own photography, their own video, and getting communities on board. And one of the things I think we've really learned from other pandemics is community and activism and taking action. We're just working on a study right now with young people who were activists in 2001 and 2002 in the AIDS pandemic in South Africa. They're now in their 30s and they are still activists. And so I think that we need this kind of activism as we go along. So many of the things that we've talked about already around women and work, what's happening in the home, what's happening in terms of mental health. I don't want to say this is like, oh, well, this will be a cure-all, but I think that the kinds of work that we can do with young people to think about this as something that you can change, go through your life is a very important part of that. So I will come back to something at the very end, but that's kind of like a solution, not a solution, the only solution, but I like the going forward. We're still in the pandemic, but in the middle of the pandemic, I think we can think about some of this work as well.
Thank you so much, Claudia. I think we're ready for the Q&A.
Wonderful. Thank you both so much for that really interesting discussion so far. We have had a couple of questions come in, and I'm going to pose those to you. For anybody who does have a question that they would like to share, please go ahead and type that into the chat box. We have a few minutes here. We'll get to as many as we can. I'm going to just scroll back up here. So at the very beginning of the presentation, we were talking about gender dynamics in long-term care. Do you have any comment on some of the other essential services, maybe in other frontline workers, maybe in grocery stores or those sorts of things?
Well, I think a lot of the things that we said about women working outside the home or not being able to work from home, and then some of the, I think the dimensions or the dynamics in terms of worry about whether you are bringing, trying to stay as safe as possible and bringing whatever infection into the home remains, I think, for every single person who's out there working on all the front lines, whether it's a bus driver, working in grocery stores and so on. So I think those are areas that I think we need to study, and we need to really pay attention to. I think we know the most about frontline workers, and we should. I mean, I think that's been very much what we've seen. But this idea of the pandemic, or a tale of two pandemics, the pandemic and then everything else around it, and how that's having an impact on women. So I haven't seen any studies other than with colleagues about, say, work in museums and galleries and so on, but the essential services pieces around grocery stores, petrol stations, pharmacies, maybe something around pharmacies is the idea that pharmacies become, because it's one of the only places besides grocery stores and petrol stations that can stay open every day of the week except Sunday, or maybe Sunday for pharmacies, that the idea of people reaching maybe a hotline or a telephone to report violence as something. And I guess the other thing is, I think maybe how how other women in these other areas are seeing the women that they come in contact with too, in terms of the needs and the worry as well.
Right, and I would just add, Claudia, that there's strength in numbers. I mean, studies show that 1 in 3 essential workers are women. And so there's a chance there to activate, to be creative, as you were saying, Claudia, about solutions, and to really organize ourselves.
Yeah, I think so. I think absolutely this, and I think we're seeing some of that, but it's one of the ironies of being, of not being able to come in contact with people. But in essential services, perhaps there are ways that women are making these kinds of contacts with other women too.
Wonderful, thank you. Another question that came in with regards to women who maybe are making that decision to leave an abusive situation, and balancing that against the fear of contagion or contracting COVID-19 in a shelter situation. Can you just sort of speak to managing that?
Well, that definitely is one of the areas that has been discussed quite a bit in the last, well, since the 27th of April, when I think there was a renewed sense of this. I mean, at the very beginning of, I think like early in like mid-March, our Prime Minister announced that there would be more money for shelters, but then it was kind of at things, I think there were so many different agendas that we were looking at that I think we became only really newly thinking about this in the last couple of weeks. And I think that is where the notion of how do you make sure that your children are safe. It's already going to be dangerous to leave, and in some cases I heard an interview with a person who was working in heading one of the shelters up the other day, said in some cases maybe it's not the best thing for women to they have to really balance all of these things at the same time, the health risks, the financial risks, and so on, and to make sure that there is like kind of a support as they are leaving, which also takes into consideration what are the health risks for children. I think, you know, as we are having these discussions across Canada about children going back to school and what does it mean to do distancing, and so on, I think maybe that the new discourses and the new narratives around what does that mean for children can, I think, have a positive impact on thinking about what will it mean to go to a shelter and what support shelters will need, even in terms of space or people working in the shelters and so on.
Wonderful,
right.
Thank you.
I would say that I know that the question is kind of more concrete about leaving, but we have to also reconsider what we think leaving looks like. So just as we're preparing for post-pandemic life during the pandemic, I think there's a lot of planning. There's a lot of things people can do before they actually leave. And so even if somebody's concerned about the physical safety aspect of the pandemic in the next few months or a little bit beyond, I think that laying the groundwork, and as you say, Claudia, getting that support network in place is actually as important as anything else in terms of leaving.
Absolutely, thank you. There's an interesting one here with regards to South Africa's decision to close liquor stores during the pandemic, and the question was with regard to domestic violence and the impact that may have had. Obviously here, the liquor stores are still open, considered an essential service. Is that something that there's any evidence that works, or what's your comment on that?
Wow, no, I haven't seen any evidence on what I haven't seen evidence that suggests that it was a bad decision to keep liquor stores open, because I think a lot of people talked about addiction and what are all of the other long-term consequences that we might look at. In the South African context, I think it was just it was quite dramatic. I have family members who actually work in the liquor industry. And so I think what is really interesting is to think about just in that on one, that was just an example of a business that is just about could probably just totally collapse. Keeping 300 people on without salary, and what does that mean? So it's been, I think there's been a real tension in terms of countries looking at other countries and saying, why well, they're doing this, or why are they not doing it? I think in terms of mental health services, and also just keeping people, I don't know, it's a hard decision. I haven't seen evidence on it, but I've heard lots of opinions one way or the other, and I think it's an important one that brings us back to what is an essential service, or what is an essential health service, or what is an essential mental state that we need to think about.
Right, but we do know that domestic abuse reporting has doubled in even just the small part of the pandemic, not from the beginning. And so it's not much of a leap to think that substances are, may have a negative contribution to that.
Yeah. It's interesting in the South African context that they've also like totally spiked in terms of violence, but people don't have access to liquor stores, but they do have access to like homebrew and like kind of these informal aspects of liquor production as well. But I think this will be a very important piece to look at, absolutely, in terms of what has been the impact of that decision, because it certainly was, I think, probably a great surprise, I think, to a lot of people that liquor stores did stay open.
But you also have to wonder what kind of signal this is really sending, and what we consider our value system in Canada or in different countries, in terms of keeping houses of worship closed, but keeping liquor stores open, or keeping libraries closed, or I mean, whatever it may be. So I think it's kind of a point of reflection, really.
No.
Okay. This is an interesting one. So as a woman in my 40s with full-time employment and young children, my mental load is unbelievably heavy, aside from the fact that I need to make the bacon and cook it. This seems to have been even more so reinforced during this pandemic. I have observed via friends and Facebook groups that this is very much a shared issue amongst women my age. Many of us have tried to speak with partners, but we don't feel that we are advancing, and there seems to be an anti-feminism movement slowly building because of the lack of adaptation in our culture. How can we support all of these women and help them work towards better living conditions, particularly within this context?
Whoa, that's a very big question. But I think a lot of things. I think something that we are seeing, I think maybe, is that there are that women are developing more support networks. People, I was reading a study yesterday that really talked about people becoming, maybe talking more intimately with colleagues than they might have before. So people being maybe more, maybe confessional is not the right word, but a term of kind of like, and I don't, it's not bonding either, but a kind of a sense that maybe it's women are speaking out more to each other. So I think that that's an important piece. I think that looking at what kinds of structures are needed, certainly wage, our women and gender equality ministry, I think, is thinking much more about even more. I mean, I think they've been doing a lot of work around on the violence side of things, but I think that they're also looking much more around the notions of empowerment and leadership and so on. So I think that maybe there will be some things that come out of this that will be improve the conditions, because this has really shown us just how difficult the situation is that we're in. And I know we're going to have, like, this is going to continue in terms of economics, and when people go back to work, if there is work, we're not going back to it in a different way, in the same way. So I think that I think for those of us who are working in areas of gender and gender equality, and trying to think about what does this mean in terms of feminism, and what does it mean for our feminist prime minister, how can we actually I think take advantage or use what we've learned about these double shifts, what we've learned about the stressors and the mental health work. Like let's not just go back and say we didn't, okay, that was then and now we're just going to move on. I think that I'm hoping that as I mentioned at the very beginning, every single sector, there is no sector that's untouched by this work in the context of its impact on girls and women. So I really think that that something we have to sort of like a COVID-19 vision for how we take this work forward. I don't know if it's very comforting at the very moment when the person who asked the question and the amount of stress that they must be under, but I think that is something that we shouldn't drop that later. I think we have to contain more of collect more of the stories, use more of this work that's from the ground up to inform what we do next.
I agree. Really and I think that this can really be a moment of reset. So because there's a time of pause, there's time to think.
Yep.
And even though it's not exactly leisure land out there or in here, there are quieter moments where we can think about what we want our relationships to be like, what we want our society to be like. If we don't want it to be like this, why isn't your partner listening to you, or why do you feel you're not advancing? Which is not a blame, but just a question. So I think that it's an opportunity to do things differently going forward. I think this whole experience is emphasizing how interconnected we are and how we can't do without each other. So how can we do that? And I think that Canada's response to the pandemic, overall has been quite unified in terms of ourselves, our communities, our friends, our families, and pulling together. So I think the empathy is really growing, and I think that there's a chance to really leverage that going forward.
Maybe I'll just add to that. I don't think that we have ever had as much attention on what's happened on people's lives and the time to follow it. I just thinking in terms of regular news broadcasts and social media and so on. Now, at certain points, I'm sure everyone gets overwhelmed, but at the same time, I think the awareness of the range of gender issues, essential services issues, connected issues around making connections have never been more apparent and more visible than they are right now.
Right, and I mean, it is Mental Health Week. And so this is a good time to think about everything from eco-pandemics to how things were, to how things are during the pandemic, and how you want them to be different going forward.
So just one question just came in here, and then I know, Claudia, that you had a couple of things that you came in at a very interesting point, noticing that the vast majority of the participants in this webinar were women. And given that the invitation went out to both men and women, how can we engage men to care more about these issues?
Well, I think that was a question we were having before the pandemic. So it's certainly one I think we continue to raise this. I think that how we work with boys and young men in schools is a really important part of that. I think the kind of activism that I talked about in terms of girls and young women, I think we have to take up with boys and young men. I think that it has to be on the agenda for more, in workplaces, I teach at McGill. How do we actually think about the work as not being, gender work as not being siloed, or gender is about only women? This is always about relationships. So the person who asked the question, I guess we need a long time to answer that. But I think that we have to do it. Maybe we will have a follow-up webinar that only men have to come to or something. I don't know. But I think we also have to make it, we have to kind of recognize, and we've been talking very much about women's work, and we've been talking about the impact on women. Well, what is the impact on men, and what are the impact? Like where are there some gendered points that we're not bringing up? If men are not seeking mental health support when they need it, what can we do to do more on that? So I think again, this kind of brings us to asking a lot more questions that we might have been asking them before, but we really have to ask them. We need the answers to them now. It's desperate.
Wonderful. Sorry, Dr. Khatri, did you have a last comment?
I think we've covered pretty much everything. I think there's a lot of hope for the future.
Good. I know that there are a number of questions that we didn't get to, which sort of really speaks, I think, to the passion that people have for this topic. So if you asked a question and I didn't get to it, I am sorry. We will take those questions under advisement, and as Dr. Mitchell mentioned, there may be a follow-up webinar or some other follow-up from there. We'll look into that for you. I know, Dr. Mitchell, that you had a couple of slides or shameless promotion that you wanted to do for some upcoming work that you're participating in.
Shameless promotion in slides, the last 2 slides. So slide 9. So this is just as we're leaving. There we go. Okay, so I am the editor of Girlhood Studies, and we are just doing a section in the next issue later this year on COVID-19. So I just want, there's a link at the bottom, and we'll be happy to share this. But we really want to look at girls and young women's lives in the time of COVID-19. If there are people out there who are in the research community, or people who are interested in thinking about finding out more about this, it's a pretty desperate and urgent request, because we want to get this work out there as soon as possible. So I'm just letting people know about that, and they can follow up. And then the last point is a slide about our International Cell Film Festival. We are running this is part of the Participatory Cultures Lab and the IHDW. The prompt is well-being in the time of distancing. We've just extended the deadline. So you now have until the 1st of June to make a 30 to 90 second cell film on well-being in the time of distancing. And we're going to have an online festival on June the 12th. And we've just had a very generous donor, Code of Canada, has just come forward with some very great cash prizes. So first prize, $750 for a 30 to 90 second documentary or fictional piece, or whatever you want to do on well-being in the time of distancing. So again, this will be recorded and we can send it out there, but you can email me directly. I see that there is an address at the bottom, but probably the best thing right now, because it's hard to read, is to email me directly. And thank you very much.
Wonderful. Well, thank you both so much for participating today. As I mentioned at the beginning, a recording of this webinar will be distributed to all registrants, and so you'll have the recording there. So if there's anything that you missed, you'll be able to see it there. Thank you again, everyone, for participating. Dr. Khatri, Dr. Mitchell, have a great day.
Thank you.
Thank you.